And thank you again for joining us for our weekly update on the COVID-19 emergency as we prepare here locally. Again, our panel has remained the same. We have Dr. Bean from IU Health, West Lafayette Mayor John Dennis, County Health Officer Dr. Jeremy Adler. I'm Commissioner Tracy Brown, and then seated to my right, Mayor Tony Rosworski, and Dr. Wickert from Franciscan Health is with us today. And with that, we'll go ahead and turn things over to Dr. Adler.
Okay. Thank you, Commissioner Brown. The format for today's press briefing will be similar to our previous press briefings. I'll be making some comments on various topics. Then we'll have time for our other panelists to make any comments that they wish to make, followed by time for questions from the media and from Facebook Live. As of today, the U.S. has surpassed 1.2 million cases of COVID-19 with 71,000 deaths. Here in Indiana, we have 21,870 confirmed COVID-19 cases with 1,264 deaths. Tippecanoe County is reporting 197 confirmed COVID-19 cases, and we still have 2 deaths from COVID-19. As I've reported in previous weeks, the Health Department is also tracking suspected cases of COVID-19. Thus far, we've had just 5 reported to us. There have been 2 additional suspected COVID-19 cases reported through the Indiana State Department of Health. The Indiana State Department of Health is also reporting 113 probable deaths 113 deaths due to probable COVID-19 throughout the state of Indiana. Here in Tippecanoe County, it is important to note that a significant proportion of our cases are associated with the Indiana Packers Corporation, which underwent testing for all of their staff last week. Approximately 60 of our 197 cases are Indiana Packers employees who reside in Tippecanoe County. Last week I mentioned that we do have a supplemental living facility in the county with cases. That facility has 14 cases. There have been no cases in long-term care facilities in our county, and we are happy to report no other clusters of COVID-19 in our county at this time. In terms of testing, here in Tippecanoe County, between the Indiana State Department of Health, our hospital labs and commercial labs, over 4,000 individuals have been tested for COVID-19. In addition, we are happy to report that there'll be 2 additional testing opportunities for residents of Tippecanoe County. The first is an Indiana State Department of Health testing site that is opening today at the National Guard Armory. It is a site that is offering free testing. It is by appointment only. The testing is for symptomatic individuals or close contacts of confirmed COVID-19 patients. Registration for the testing needs to be completed either by telephone at 888-634-1123 or via internet at https://lhi.care/covid testing. In addition, the State Department of Health is also testing individuals at the Lafayette Jefferson High School from today through May 9th. This is also free testing on a walk-in basis. This testing, though, is limited to symptomatic healthcare workers, first responders, or essential workers who are symptomatic, and then also symptomatic individuals who are in high-risk categories due to age, weight, or underlying health conditions. The Indiana State Department of Health will also begin their statewide contact tracing program on May 11th. So that will provide assistance to Tippecanoe County and to other counties with contact tracing. As we've discussed before at these press briefings, the Indiana State Department of Health is projecting the surge in COVID-19 cases to occur here in the state of Indiana during this week and next week. In addition, several models of COVID-19 have now predicted or now projecting an increase in COVID-19 deaths across the U.S. And this is being attributed primarily to the relaxation of social distancing rules and restrictions across the country. A big topic of discussion, of course, this week in Indiana is Governor Holcomb's Back on Track Indiana plan, which was released on May 1st. As our state and community begin to reopen, it may be tempting for all of us to think that the COVID-19 pandemic is behind us. Unfortunately, it is not. It is absolutely imperative that we remain steadfast and vigilant in our approach to this pandemic. Now more than ever, we must all be smart and cautious and act responsibly. We must continue to maintain a social distance of 6 feet when in public settings. We must wear face masks when in public settings, especially in crowded places like stores. We should frequently wash or sanitize our hands and disinfect high-touch surfaces. And social gatherings need to be limited as directed by Governor Holcomb. Currently up to 25 people while following social distancing guidelines. In addition, individuals 65 years of age and older and those with high-risk health conditions should remain at home whenever possible. Businesses that are reopening should modify their operations and their workplace environments to optimize social distancing and protect customers and employees per the Tippecanoe County Health Department's previously issued directives for essential businesses. Businesses also need to establish plans to regulate their customer capacity per Governor Holcomb's directives, which are currently set at 50% or 25% in mall common areas. We don't want to let our guard down now and endanger ourselves or others. Let's act smartly so we do not undo everything our community has accomplished to lessen the impact of COVID-19. The Health Department will continue to monitor COVID-19 infections in our county and may issue additional requirements if necessary. The Health Department will be closely monitoring the number of confirmed and suspected COVID-19 cases, our percentage of COVID-19 tests that are positive, the number of hospital admissions for COVID-19, the number of ICU admissions for COVID-19, the number of emergency department visits for respiratory illnesses, and the number of deaths due to COVID-19. With the release of Governor Holcomb's Back on Track plan, the Tippecanoe County Health Officer's order issued on April 8th pertaining to community events in Tippecanoe County is amended to be consistent with the governor's plan. And those items are, number one, residential and day camps are closed until May 24th, pending CDC guidance. Number two, recreational sports leagues may resume on June 14th. Number three, fairs, festivals, and sports events may resume on July 4th. And except as noted above, social gatherings following social distancing guidelines are allowed as follows. Beginning May 4th, up to 25 people. Beginning May 24th, up to 100 people. Beginning June 14th, up to 250 people. Beginning July 4th, more than 250 people. This order may be further amended if deemed necessary by the course of the COVID-19 pandemic. And that revised order will be posted following this press briefing. At this time, that concludes my remarks. I'd like to open the floor to our other panelists if they have any additional comments they'd like to make.
By unwritten protocol, I will go again. So Jim Bean, Chief Medical Officer for IU Health Arnett, and I'll update by saying that we are seeing a bit of a surge in our hospital. We have 10 COVID positive patients as of early this morning and a similar number under investigation. We continue to be in phase 2 of our 5-phase surge plan, so well within our capacity, and we have adequate equipment and personal protective equipment to meet current and increasing demand. We remain very focused and vigilant on those supplies, and continue to be grateful to the colleagues who have flexed their schedules and taken up new roles and have been displaced from their prior practice sites to fill in and support demand and need as it expresses itself. Remain very concerned that the surge will continue to grow and that our resources will be put under increased pressure.
Thank you. Other comments from our panelists?
Go ahead, John. Okay. Well, just real quickly, I think one of the lessons that we have learned, not just through the COVID-19 issue, but in general, is just because you can doesn't mean that you should. The virus is still very active. The transmission of the virus hasn't changed. It's still there and it can be easily transmitted. Social distancing and wearing masks when social distancing doesn't apply are absolutely imperative. It's unfortunate. We as humans oftentimes think that that first step towards the relaxation of something is the green light to go back to normal. We're not going to see normal for quite some time. Hopefully we can see normal by the 4th of July. But in the interim, we need to maintain personal and group discipline. The one thing we know for sure, until there's a vaccine, the only cure for this, or the only way to slow this down, is to keep it from spreading. And the only way we can keep it from spreading is to keep apart. So please, this is not the beginning of the end. This is just another way to help deal with the social crisis that this virus has basically caused. But we still need to maintain discipline. We still need to maintain distancing. And as I said before, just because you can doesn't mean that you should.
Thank you, Mr. Mayor.
Well, and again, we have the tools that we need in terms of business and everything. Undoubtedly, the open up is more difficult than the close. I think we all recognize that. So again, we would just ask citizens to be very patient and understand that things aren't, as the mayor said, things aren't going to be normal right away. And the best that we could hope for right now is summer. But I am encouraged because I know local businesses, especially restaurant industry and things like that, are working on the recall process and everything that comes, and certainly we urge folks to continue to be supportive of all of our area businesses because they have suffered in this very difficult time, and they're going to need our help again to return to what we had before. So,
thank you. I'd like to start today with just a quick update on the city of Lafayette. We did have a second city employee that tested positive for COVID-19 this week, and we are following all the necessary protocols that are put in place for this type of situation. I'm also happy to announce that the first employee that was diagnosed has recovered and is back to work and fully functioning. So we're very happy to be able to announce that. And I think what John and Tracy said is really important. You know, we were on a conference call yesterday, some of us with a lot of our area businesses, along with Dr. Adler. And there's some really great things going of what people are doing in our business community to make accommodations, to practice social distancing, to try to keep their employees safe and still meet the needs of their customers. And I think everybody is working really hard and has worked really hard up to this point. But with that being said, this really becomes the most difficult, I think, transition period that we're in. We know that through increased testing, we're going to see the number of cases elevate, and we need those people to properly isolate and quarantine themselves. And then all of us, we really are getting into that personal responsibility phase where we need all of us now, as things slowly open back up, to take that personal responsibility to practice our hygiene, but in my mind, very importantly, is to wear our masks. So when we are out in public, in grocery stores and some of these other settings, as there begin to be more and more people, we need to see the number of people wearing masks in those settings, in my opinion, to greatly increase. And that becomes a very important piece of our line of defense here, because as we open up and there is more potential interaction, we're going to have to work harder than we've actually worked now to make sure that we keep this under control. We don't overwhelm our healthcare facilities, and we allow this to continue in a way that is safe, but as Tracy mentioned, that does allow for some of that initial reopening of the economy, because people are hurting. There are people that have lived paycheck to paycheck. They're in danger of losing their home or where they rent, and meeting all their financial obligations. And so really by practicing what we're supposed to be doing, wearing those masks, we're helping people in a lot of different ways, and we're showing respect for those people that are struggling and those businesses that are struggling, because the last thing we want to have to do is tighten up these restrictions or make some changes because we weren't able to do this and things got to a point where that was necessary. So by doing those things, we're actually showing respect and kindness and compassion for each other by the way that we're taking those measures to ensure that this process can continue. So, thank you.
I would like to express our continued appreciation for the community and the way that they have demonstrated their support for the hospitals and the hospital workers. That continues to be known by the medical staff, by the nursing staff, by all the support staff at the hospital. So we really do appreciate the way the community is supporting our healthcare workers. And then just want to recognize the great work that our healthcare workers are doing at the bedside, at all areas of the hospital, and that work that's being done. Oftentimes there's some anxiety about working in that environment, but we are really encouraged by the support and by how well our healthcare workers are providing their care. We also have seen a slight upsurge in number of individuals who are in the hospital. We're currently at about 16 patients who are positive in the hospital, still within our realm of what we're capable of handling, both from a standpoint of patients, our PPE use, and ventilator use is all within the ranges of where we're at currently. We have gradually started to reopen in many different areas, both our surgery, outpatient procedures, radiology, cardiology, all gradually reopening, gradually doing a few more elective cases, working through the process. That whole process has to be redesigned as how to get individuals from their car into their appropriate space in the hospital with appropriate social distancing, and all those processes have to be redesigned. So it has been an interesting challenge to come back and reopen. We thought that was easy. We'll do it like we did in January. No, we will not do it like we did in January. It's a very, very different process all the way around.
Thank you. At this time, we'll open the floor to questions from the media and from our Facebook Live.
Good afternoon. Ron Wilkins from the Journal-Courier. Both the doctors have talked about the hospitals and the increase. I think you said 10, and Dr. Wickard, you said 16 patients. And you said you were both comfortable. Of those numbers, are those Tippecanoe County folks, or are you guys taking COVID cases from surrounding counties? And how stressed are the hospitals at this time and in the foreseeable next couple weeks?
So I don't know the home location, county location of the patients. Both hospitals are referral centers and receive patients from the surrounding region, so it wouldn't surprise me if we have patients from multiple counties in both facilities. So that's the answer to that one. The second one is how stressed are we? So as I said, we're in phase 2 of a 5-stage surge plan, which at the 5th stage we would be taking atypical space in the hospital, a lot of it, and turning it into inpatient care space. So that would be, we hope we never get there. Right now, and for the the foreseeable growth of cases, we're well within what we have planned to address. Dr. Wickert and I had a conversation earlier this week because patient volume was increasing at Franciscan before it started to pick up at IU Health Arnett. And the conversation was, how should we as the two hospitals serving this region share the load, if you will. If it starts to really overwhelm one of us before that hospital flips to more unusual or heroic efforts to try to manage a larger volume, how do we partner in meeting that growing demand for the whole region? And I feel really good about the conduit of communication and connection that's happening, not just at his and my level, but at other levels throughout both of our organizations.
And I would say that we both hospitals here serve as regional hospitals. So we serve the region. So we have individuals from multiple surrounding communities. We also serve the region in the sense that both of us have specialists that other smaller hospitals may not have. And in this crisis, in this pandemic, individuals need more specialized care from both an infectious disease standpoint and from a pulmonary care standpoint. And so oftentimes we will serve as those resources for smaller institutions that need that additional help from individuals who are very, very ill with this COVID-19 virus, particularly from a respiratory standpoint. So we have served as that conduit. So we do have individuals from surrounding regions and communities that are in both our hospitals, I'm sure.
Hello all, I'm Anna Darling from WLFI. We saw a surge in cases here in Tippecanoe County, especially over the weekend. Is there a specific reason why there was a bigger increase over the past week?
Sure. So the majority of the new cases that have been reported here in Tippecanoe County starting on Sunday of this week, the majority of those are attributed to the Indiana Packers Corporation. Last Thursday and Friday, the State Department of Health tested all Indiana Packers employees. I believe it was 2,500 people. And some of those employees live in Tippecanoe County. And so we had about 60 of our Tippecanoe County residents who work at Packers test positive. So, when you look back 1 week ago at this press conference, we had 102 confirmed cases. Today it's 197, 60 of those attributed to the Indiana Packers.
Thank you so much. This is more geared toward the commissioner and mayors. Are you guys prepared to go against the governor and his orders or his plan to reopen should we see a bigger increase in cases here in Tippecanoe County?
Well, in West Lafayette, we are enthusiastically hoping that things will work out well. But yes, we have a plan B. We're also encouraging those who can to stay at home and work from home. We're in the process of completely redesigning workspaces. We're using plexiglass to segregate one office space from another. We're obviously going to be closely monitoring personal contact and personal spacing. Everything that we're observing now as a society is going to be multiplied when we do it insofar as what we have in our current City Hall. To that degree, we are somewhat lucky because it's an old school, it's a massive building, and we're going to be putting people, if it's a compressed workspace, we're going to be relocating them to other classrooms, we're going to be utilizing the second floor. So the spacing shouldn't be an issue. But I think the important thing to remember is that we're all in this together. This is something that we can do as an example of leading by example. So for us, we're going to encourage, if you can stay at home and work at home and you can be productive, that's fine. If you want to come in, you're probably going to have to ask somebody where your office is because it's going to probably be relocated.
Is it beyond all possibilities that things could be different here locally than they are across the state? I think you don't have to look very far from our hometown and our community to see that things are much, much different just a 40-minute ride north of here. The numbers are what we are going to watch. We all want the same thing. We know that target date of July 4th, what that means to us as a community, symbolic as well. But the one thing that I can assure our citizens who have questions about that, and that question gets asked a lot, is the people that are involved in this decision-making process have been working together since day one. And that won't change. We're going to continue to be in this together and make those kinds of decisions at a very high level together as well.
I'll just reiterate that just like I think Dr. Adler laid it out well, some of the guidelines that we're looking at and some of the additional things that will factor into that. As Tracy said, we're trying to stay in line and we're trying to be proactive. So like the phone call we discussed yesterday with many of our business leaders and the different information that we're trying to get out so people can do this effectively and we don't run into that situation. We're all working very hard to have that level of communication take place because, again, in some sense, we do control our own destiny by how well we all adhere to the guidelines and how we all well take personal responsibility to do those things as we manage through this, measured reopening. So a lot of it's just going to depend on, what we do. There's been a few things recently, in a few days from other areas that have affected us in a way that we can't necessarily control, but I feel like we are working through those. But if we, stay vigilant, then we should be fine.
Hi, Ron Wilkins again from the Journal and Courier. Dr. Adler, with the increase in testing, confirmed cases will obviously increase. And with the surge coming, the number of cases will increase. What are the metrics that you have set forth that might have you tap the brakes on the and apply tighter restrictions to the governor's schedule? What specifically metrics are you looking at there?
Sure. Yes, and you are correct. As testing increases, we do expect our number of confirmed cases to increase. That would be the case here as it would be anywhere else. So what we look at is not just the number of confirmed and suspected COVID-19 cases. We also look at the percentage of COVID-19 tests that are positive. For example, in the state of Indiana, 18.1% of tests that are done for COVID-19 are positive. Here in Tippecanoe County, that figure is 6.94%. Compare that to last week, 1 week ago, it was 6.3%. So a little bit of an increase in that proportion of that percentage of positive tests, but still below the statewide rate of positive tests. So we look at both of those indicators. We also look at the number of hospitalizations, hospital admissions for COVID-19, the number of intensive care unit admissions for COVID-19, the number of emergency department visits for respiratory illnesses, and the number of deaths due to COVID-19. So we don't just look at one number, we look at a conglomeration of data, and we look for trends in that data so that our decision about restrictions and whatnot will be driven by data. And we hope that more restrictions aren't needed, but it will be a very carefully made decision with much contemplation, much consultation, not only with other folks at the health department, but also with all of our elected leaders. And it will be a decision driven by data. So we're watching that data very closely on a day-to-day basis.
Question from Facebook Live from Sheila. Why don't we require masks?
Governor Holcomb's Back on Track Indiana plan states that masks are recommended for all of us when we're in public settings. And so we are acting consistently with Governor Holcomb's recommendation. Myself and everyone up here, of course, we strongly recommend that everyone wear face masks in public settings, especially in settings where social distancing can be difficult. So those are settings that are crowded, like grocery stores and other retail situations. Again, we can't emphasize enough how important it is that we really all follow the governor's recommendation about this. If we all wear face masks, that will help us greatly in our fight against COVID-19.
And to that point, actually, I know Tony's doing this too. We're actually providing masks for our employees at City Hall. And they're the cloth, rewashable, the fitted kind. And again, obviously for the focus of making sure that we don't transmit, but also to send some messages. You know, when they see city employees, whether they're on the back of a trash truck, inside a squad car, or on a fire truck, they're wearing masks, they're going to realize that this is a big deal. And as always, leading by example sometimes is the best way to go.
Message from Facebook Live for Tracy. Will there be property tax extensions?
There is, under the initial executive order, a series of executive orders from Governor Holcomb, property taxes were due the 11th, and that date has not changed. However, the penalty has been waived until, I believe it's July 10th. We do have our main lobby in the county office building open right now for folks who are wanting to come in, and we have a queue set up that has people safely socially distanced so that they can take care of that business. But yes, there has, in a roundabout way, by alleviation of the penalty, been an extension granted on all property taxes.
Ron Wilkins from Journal and Courier again. The 197 cases that have been confirmed, is there any way to break that out as far as how many have recovered, how many are hospitalized? Obviously, we know 2 deaths, but how many have recovered, how many hospitalized, how many are convalescing at home?
Both Drs. Bean and Dr. Wickert were able to provide hospital data to you today. In terms of recovery, it is actually, believe it or not, more difficult than we thought it would be to determine recovery from COVID-19. The CDC has established some criteria for when somebody with COVID-19 can be released from isolation. However, they just modified that the other day to extend the period of time that an individual should remain isolated when they have COVID-19. And the reason they did that is what's being observed with COVID-19 is that the recovery period is much longer than people anticipated, and at times can be longer than 2 weeks, 3 weeks, 4 weeks before a person fully recovers. So, and then I'm sure you've heard that there have been individuals, not here in our county, but elsewhere, who have been presumed to be recovered from COVID-19, and then they're tested for the virus, and there's still evidence of virus in them. So the definition of recovery is still not entirely clear at this point, so it makes it harder to figure out when somebody's actually recovered from this. I think as time goes on, we'll learn more about this and have more information about recovery and when can we actually declare somebody recovered from COVID-19. But it appears to be a longer recovery process than everyone anticipated.
Anna Darling from WLFI again. Are either of the representatives from the hospital able to provide any more clarity on recovery tracking?
So I would second Dr. Adler's comments that it's somewhat difficult to track that. One thing that we are doing now, which I'm going to learn a lot more about later this afternoon, is for a number of patients who have tested positive and are isolating at home and recovering at home and don't require hospitalization, we are connecting with them via an app and a text message program where they are queried twice a day about their current state and some core symptoms, and that information is being monitored in real time on a large number, dozens of patients right now. I want to say dozens of patients I know who are being monitored in that fashion, many of whom have oxygen saturation monitors at home, little portable devices to put on their finger to upload that information once they get that text message reminder. And so that's one way that we're managing the recovery of patients who don't require hospitalization and who aren't requiring face-to-face visits to assess them.
To my knowledge, we do not have any of that information about individuals who tested positive. We'll keep track of individuals in the hospital, but really individuals on an outpatient basis who would come just through a testing facility, we are not monitoring that to the best of my knowledge.
Question from Emily Seiberg from WBAA. In what ways does contact tracing become more difficult as more restrictions are lifted on residents, allowing them to visit more places and be around more people?
Yeah, that's an excellent question. Yes, as stay-at-home orders are lifted and there's more reopening of businesses and organizations and activities, then naturally there is more contact between people, and the contact tracing does become more challenging. Part of the contact tracing process, of course, is interviewing the infected individual and finding out from them who they had close contact with, and then those individuals are, of course, reached out to and instructed on quarantine and so on and so forth. One thing that we think will help with contact tracing is the Indiana State Department of Health starting their large contact tracing program here in the state of Indiana on May 11th for many counties, May 18th for other counties. Tippecanoe is in the first phase, so May 11th. That Indiana State Department of Health contact tracing team will consist of over 500 people whose full-time job it is to work on contact tracing. So it's helpful to have a large number of people working on contact tracing, especially as we move forward with reopening our community and our state.
Question from Facebook Live. When someone is tested due to workplace exposure, are they notified if negative or positive, or is it the responsibility of the one being tested to follow up?
Was the question is the employer notified, or is the
employee notified if they're negative or positive, or do they need to follow up?
So the employee would be notified by whichever healthcare provider ordered their test, or if their test was done through one of the new Indiana State Department of Health testing centers here in Lafayette, then those testing centers will contact individuals about their test results. Test result information, of course, is confidential medical information, so it would not be shared with other individuals without the permission of the person being tested. So the employee would be contacted with the results. Yes.
Another question from Facebook Live. The governor's Back on Track timeline states restaurants and bars can open at 50% on May 11th, yet also states bars and nightclubs stay closed until June. Please define the difference between bars.
I'm looking at the governor's plan right now. So restaurants and bars. So in his Back on Track plan, it states that 1 week after the start of Stage 2, so on May 11th, restaurants and bars that serve food may open at 50% capacity with operational limitations. Bar seating will be closed. there'll be no live entertainment. So I think my interpretation of that is that if a bar is also a restaurant, that it can reopen with the same stipulations and requirements that other restaurants do have. If it is strictly just a bar with not really any restaurant functionality, then it would remain closed until a later date, according to Governor Holcomb's Back on Track plan.
Ron Wilkins again from the Journal and Courier. This one's for the mayors and Commissioner Brown. What are your plans for reopening playgrounds that are currently cordoned off? You got people not staying at home now. They want a place to go and play. So
That, I think we can answer for all of it. That's actually outlined in the governor's order. Playgrounds specifically can open on,
24th.
I think, the 24th
May
of
24th.
May. That's specifically listed in the order, so we would be following that. Playgrounds, the basketball courts, and things like that can open on the 24th.
The hoops go back up on the 24th. Yeah.
Question from Emily Seiberg from WBAA. How exactly will local restaurants determine the 50% capacity?
That's a great question. What we will most likely be using is the restaurant capacity as determined by the fire marshal. All businesses, including restaurants, have a maximum capacity that is determined by the fire marshal. And many of you have probably seen that posted in restaurants or other facilities, what the maximum capacity is, so that it would be 50% of that number.
And I would just add to that there are some smaller retail and places that can only add so many per square foot, and we have received a lot of calls about that. How do they calculate their capacity to make sure? And so on the Lafayette Fire Department's webpage is the formula that's used to calculate that capacity, and then you just divide it in half for 50%, and to give people some idea that may not have a specific capacity designated to it.
this seems a bit obvious, but while you're waiting for your table at the restaurant, what can people do to stay safe?
Yeah. Well, it will really be part of restaurants' reopening plans to take a look at areas in their restaurants where there may be congregation of people, formation of crowds, and come up with modified setup or some other sort of system to prevent that from happening. And that may involve people waiting outdoors. It may involve you go in and you give your name to the hostess or host, and they may say, I'll take your cell phone number, go ahead and wait in your car, and we'll call you when your table's ready. So there are ways that they can work around that, but the idea is to prevent the formation of crowds inside or outside the restaurant, especially when there's a crowd where social distancing is not being practiced. You know, certainly they could, if they had in their waiting area marks 6 feet apart where people could wait, that would be acceptable.
And again, I think, if people are uncomfortable with that, because you don't have to wear a mask. I mean, wear your mask until you go in and you're ready to eat. If you're outside, that's where that mask can help so much in solving some of those issues.
Hi, Anna Darling from WLFI again. As I believe per the governor's new plan phase, gatherings of 25 people or fewer, is that correct?
Yes.
25. Is there anything our local law enforcement will have any power to, if there's a party happening or if there's a large gathering, is there anything our local law enforcement can do to enforce that?
I can just tell you real quickly, we've been spending a lot of time doing that. Every day, I get several phone calls and several texts and several emails about citizens that have casually observed a conglomerate of people gathering inappropriately, whether it be in a designated area, whether it be just somewhere else. And our police department has taken it upon themselves to go ahead and issue the warning. Also has our fire department in the event that they observe something while on a run, or not on a run, but while they're doing some of their training practices, they go do the same thing. And the good news, bad news of that is our officers are wearing masks, so they're leading by example first off. The bad news is that the presumption is that if law enforcement professional says, hey, stop, separate, we have not yet been challenged, but that's the concern. What if somebody says no?
Follow-up question from Emily from WBAA. What if the 50% of restaurants' capacity does not allow for social distancing?
Well, I mean, social distancing is our mantra right now, and that's the most important thing. And so businesses are expected to modify their operations and their workplaces to optimize social distancing. And so if a particular restaurant, even at 50% capacity, can't allow for appropriate social distancing, then we would expect them to reduce their capacity even further so that social distancing could be maintained appropriately.
Question from Facebook Live. Leanne, do the numbers from surrounding counties impact our decision-making on restrictions, given the areas like the mall attacked regional visitors?
Yes, we certainly watch numbers in surrounding counties because we are very cognizant of the fact that Tippecanoe County is a retail and activity center for a lot of surrounding counties. So we do watch those numbers closely and think about how other counties' numbers could impact us, particularly with regard to hospital utilization.
Question from John from Facebook Live. What are the plans for preventing or handling a surge when the Purdue students return?
That's also an excellent question, and we've had some discussions with Purdue University. They are still in their planning phases. They have a task force that has been assembled to come up with the university's plan for how they're going to manage their student population as safely as possible, and what steps can be taken on the Purdue University campus to protect and prevent infections, and then also what to do if they do have students who become ill.
And this gets down not just to the social level, but in classrooms, in hallways, in dormitories, and fraternities and sororities. The information is being disseminated broadly and early. The good, bad news about this whole situation is that unless you're living in a cave, you know what's going on. And the two big mantras that we've been saying, every one of us has said it multiple times up here: social distancing, and then when necessary, wear a mask. And Purdue, because of their plan to open this fall, is making that not just something to be heard, but something to be recognized and understood.
Another question from Facebook Live. Is information being collected shared with Tippecanoe County when the state does the contact tracing, or how is the information being stored?
Of course, our expectation and hope is that the information is going to be shared with the local health departments. I think that the State Department of Health has always worked really well with local health departments. We have a really good relationship with the State Department of Health, and we really see our relationship as as a team, and we try to help each other out as much as possible. So I would expect that that information will be, of course, shared with us, and they may call on us to assist with various contact tracing activities or assist with the care or arranging care for individuals who are sick.
Another question from Facebook Live from Julie. We're curious when recreational sports such as baseball will be allowed to start practicing.
So the governor's Back on Track Indiana plan specifically states that recreational sports leagues may resume on June 14th. In the absence of other guidance from the governor's office, we at the health department interpret that to include practices also. So until we hear otherwise, practices would be allowed to resume on June 14th.
Question from Emily from WBAA. Governor Holcomb said this week that places of worship would be considered test or control groups. What is the health department's advising faith leaders about in-person services, and is it appropriate to expect faith groups to take on that responsibility?
I'm not familiar with the statement that was made about any group of people serving as a test group. I'd want to hear exactly what statement was made before making any comment about that.
No more questions.
Okay. Thank you very much, everybody, for attending, and we'll see you next week.